I get a lot of comments in here from people and they're like, you do so much Botox. And I'm like, no, I do a lot of laser. I do a lot of laser. Look at that. No laser, laser. This is going to prevent me from having to get Botox. I do Botox in my jaw. I do it in my armpits. It's literally a miracle injection. And I also stay consistent with my LED mask. So those two things combined, you won't have to get Botox today. Maybe in a few years, but not today. It's going to be a good glow. I get a lot of...
This video was executed perfectly in every single way, and there's a lot to comment on here. So, is laser the actual solution? Is Botox the solution? Where do these actually fit together? And you don't hear much about laser on social media and beyond. It's almost like a hidden secret within the dermatology world. And Dr. Maxfield and I have been working very hard to bring more laser content to you. So you'll hear a lot more about this. We'll demystify this space quite a bit, but there's a lot to unpack in this video, and we're going to target it. We're going to go after it one by one, and we're going to address each of these points.
Right, and this video is more of a critique of your critique, and if it's not you, it's certainly someone around you, their critique of Botox and all of these different individual treatments and procedures. But this is the secret to longevity. Here we go.
Here we go. Let's start at the very top. What happens when we age? At every layer of the skin, there are different aging things that are occurring. So let's start at the very top. At the very top layer of the skin, the stratum corneum layer of the skin, we're getting increased thickness of that stratum corneum layer, increased flakiness, and more dullness is occurring at that layer. At the rest of the epidermal layer, you're also seeing decreased skin cell turnover. So your skin cells are just not turning over as fast, again, making you look more dull and not as rejuvenated. And that also is why your dark spots stick around for longer. We go a little deeper. Now we're in the dermal layer of the skin. This is where your collagen is, this is where your hyaluronic acid is in. And so as you lose collagen and elastic fibers, you develop wrinkles, your skin gets saggier, it becomes more crepey, and so that collagen layer of the skin is very important. Beneath that are the fat layers of the skin, and your fat pockets essentially move, sometimes they diminish, and they move in the direction of gravity. This is why you get jowling, this is why you get your fat pads herniating when you see people with festoons underneath the eyes, and so that's happening in your fat layer of the skin. And then beneath that even, you have the muscle layer of the skin, which seems to stay pretty consistent with your age, just due to gesticulations as you move your mouth and move your forehead and frown. All of these things keep your muscle volume about the same, but then even beneath the layer of the muscle, you also have your fascia, which isn't as strong or constricted as maybe before. And then even beneath that, you have your bone layer, and at that bone layer, you get actual resorption of bone. So many things are happening when you age, and I say this because some of these things are going to happen no matter what you do, and you can't prevent all of those things. But targeting each of these layers individually and being very thoughtful about it can actually help you age properly.
Right. Now, I guess to the heart of this, there is so much structural change beyond the skin that is occurring when it comes to the aging face. It is always questionable, and reasonably so. From my perspective as a professional, like, will treating the skin solve all the issues? And the answer is universally no. And so with this individual, when he says, oh, you say I do too much Botox, I get so much Botox. Well, actually, I do laser. Well, actually, Botox is great, and I use it here, here, and here. And actually, I also use LED light. Like, what part of this should you be incorporating, and how do each of these individual factors come together to create a comprehensive, healthy appearance?
And what is even laser? I guess that's the other question. And which laser, right, is going to be the one that's going to give you the results that you want? So I will concede that, first of all, I love this video. I thought it was really well executed. Like I said, I don't know, I've never seen this person's content before, but I love him automatically because I just love the way that he presented that. And I think there's some truth in everything that he's saying there for sure. So one, Botox is heavily demonized. It is a miracle injection because it does so much more than just treat fine lines and wrinkles. It was initially developed for blepharospasm, where people were getting contraction of the eye, and then people noticed that it got rid of the wrinkles, and that's how it became a cosmetic injection. It also stops the way it works on muscles is it stops the release of acetylcholine, and by doing that, it also helps with eccrine stimulation by acetylcholine, so it helps stop you from sweating. And it also just has other benefits like stopping muscle contraction for people who get tension headaches. It's good for people with bladder spasms, and so it really is truly a miracle injection. And I think it gets a bad rap because it's botulism toxin, and people think toxin, like, why would you inject a toxin into the body? But it's very safe, and in batches that are not contaminated, we've never really seen any negative or widespread consequences of using it.
Right, and I'm doubling down this year. you're going to hear me say this at least a dozen more times this year. Botox is probably the greatest ingredient ever made. And I'm really, really anchoring on this, really like putting my foot down on it because of the demonization of it. Everything is like Botox in a bottle. Everything is your Botox alternative, and none of them deliver. None of them deliver. And so I'm just...
Except for Dysport and Jeuveau, to be clear.
They are botulinum toxins.
All botulinum toxins are the same
Right.
or similar, let's say.
Yeah, so I'm speaking in terms of not the brand Botox, but that's kind of common speak. Like you're Googling something, we're Botoxing it, right? So all of these brands that utilize botulinum toxin, they are effective. You will get what you pay for in terms of results. Nothing mimics the effects. And as far as safety, it's really extremely safe compared to most other procedures. And yeah, I think it's outstanding. So I'm gonna die on that sword this year. You can watch me do that, but I just am tired of people losing their time, money, and putting effort into things I know won't deliver for them. And also it's a toxin. Like when we were training, the reps would come and be like, yeah, this is a purified protein derivative. We don't like to say toxin. It's a toxin. It needs to just own it, and everyone kind of just needs to come to terms with that. It's a toxin, and it's thoughtfully used, deliberately used, and it delivers.
Now let's talk about the next part of this, which is the idea of preventative Botox. So what is preventative Botox? And basically in this video, he's suggesting that you won't need Botox sooner if you do these other treatments first. And I actually think that there is some truth. I think we might disagree on this quite a bit. I actually think there's some truth in that, because I do think that when you're younger and your skin is the healthiest it's ever been, if you make a frowny face when you're a baby, right? Let's say that you're 14 years old, you make a frowny face, and then you relax your face. It's not going to etch that line into the skin. And the reason why is that your elastin production and your collagen production and all the other things that you have going for you when you're younger in your skin, you don't have as much sun damage. Your skin is able to recoil better. It has the plumpness and the volume that helps your skin recover from muscle contraction. Now, as we get older, as your collagen gets weaker, as those muscles get stronger, and as you're not able to recoil as quickly, those etched in lines start to stay in the face. And this is what we're trying to prevent with Botox. So I do think that if you keep your skin healthier for longer, that you will prevent wrinkles from forming for longer, even without inhibiting muscle contraction. This is kind of where I fall, but let's talk a little bit about preventative Botox, because I think there's a lot of confusion around this term. And I've even seen dermatologists say that, they don't recommend preventative Botox, but the truth is that all Botox is preventative. It's actually the only thing that it does is prevent things, because it doesn't treat wrinkles once they've formed. They can soften wrinkles over time by stopping the muscle contraction, but it's actually best used to prevent lines from forming before they've formed than they are at eliminating lines once they've already formed.
Right. So if you think about how you develop lines, let's just use my forehead lines for an example, because they are all dynamic at the moment. This is dynamic movement, meaning that if I move them and go to relaxation, they kind of disappear. Now, static lines, and I do believe I have some that are starting, they are persistent. Dynamic lines become static lines. And if you stop the dynamic movement with Botox exclusively, then you prevent them from transitioning into static lines. You just stop the lines from forming, and that's how this ingredient works best. That inherently is preventative Botox. Now, I think where some people are trying to get their point across is they're saying you don't need to do it when you're 20, you don't need to do it in your teens, because you haven't started that journey really towards static lines, and this is true. But even in your mid-20s, those static lines start to develop. Even for some people in their early 20s, these static lines start to develop. And so it's very personalized. Once the dynamic lines, once those movement lines become persistent, even when your face is at rest, it is absolutely time to use Botox if that's something you want to address.
So I think one of the better analogies here is that of a leather shoe. So if you think about your skin as a leather shoe, when you get a nice new leather shoe, it's got no creases in it, it's got no folds in it. And the more that you move your foot in that shoe, the first time you move it, you may not get a crease that stays in there for long, right? The shoe creases, but then it kind of goes back. But as you crease in the same place over and over and over again, that line starts to get etched in to the point where it doesn't ever come back. And in fact, the leather starts to get softer in that area with time, where then you get wrinkling and creasing all over a lot easier, right? So there's really two things that you can do to prevent this from happening. Is you keep the leather stronger, sturdier for longer, and maybe even use a better leather in some ways, right? Your skin being the leather, is there a way to make your skin better? The second thing you could do is just not move, right? Not move. So that's something that you could do. Or third, what you could do is when you're not wearing your shoes, you could stuff them and stretch them so that they kind of fill with volume. But in the end, and stopping that muscle contraction, which is what Botox does, and stopping that folding of the shoe, which is, by keeping your feet straight or walking or whatever, you could potentially prevent this. It would prevent the creases from forming in the first place. And probably the best thing to do is to prevent the creases from forming in the first place, because everything else is harder and not as effective at treating it.
Right, and that's where just a few minutes ago he said we kind of differ, because the way I picture this, I think of Botox as being more proactive or having the potential to be more proactive, and I think that lasers tend to be more reactive, where you're coming behind and trying through deliberate damage, trying to stimulate recovery to undo some of the signs of aging that are already there, whether it's fine lines, texture, dark spots, etc. It's kind of a reactive treatment. So I personally think even though if you use laser to kind of strengthen the health of your skin overall, maybe you could push Botox out a couple of years, but I actually think the relationship should be the other way around, where by using Botox, you might not need to reactively treat the wrinkles that formed because they never had the chance to form. But that's specific to wrinkles. That's only specific to wrinkles because laser does so much more. So let's say we've settled on wrinkles. You're like, okay, you can use preventative Botox to treat it. I buy that. You can use lasers to obliterate the wrinkles. I'll buy that. Now, that's just one issue in the skin. Then you have the texture quality. Then you have the dyspigmentation. Then you have the other things, the other growths on the skin. You have the oil glands that occur over time. This is the CO2 laser. So an ablative laser or an erbium laser or a multifrax, multifrax isn't ablative, but it does cause changes in the skin from a structural standpoint. All of these things are going to more address the skin health overall. So they're going to address more globally changes in the skin associated with aging. And the complementing relationship of laser to Botox is additive, if not synergistic.
Right. So let's talk about the next part of this, which is what does laser even do and how does it even fit into this picture? Now, there's a lot of different devices. And like I said, you got to think about the layers of the skin and which layers of the skin these changes are occurring in. So for example, if you're doing laser, it doesn't affect the muscle layer of the skin, for example. Now, there are procedures that can target the fascia, like ultherapy, but in general, when we're talking about lasers, they're targeting different chromoforms. So they're either going after a different color, which is usually pigment in the top layer of the skin, or blood vessels, which are in the dermis, going after redness, or they're targeting water and basically just resurfacing the skin. And so when that happens, you get improvements in texture because it goes through the epidermis and it goes through the stratum corneum. So you get improvements in texture. You usually get improvements in dyspigmentation, discoloration, melasma, for example, and that's through that resurfacing of the skin. And then thirdly, you also get stimulation and remodeling of collagen and your elastin. By causing this micro damage and by causing this heat-induced coagulation around most of the laser columns that occur in the skin, you're getting that stimulation of collagen and elastin production, which are going to thicken those layers. They're going to make them more resilient, and they're going to send your skin back to where it was, let's say maybe 5 and maybe up to 10 years, depending on how aggressive a laser could be. So that's how these are working, but they're really only targeting that epidermal and that dermal layer of the skin. They don't go any deeper. And so the changes that you see, for example, with bone remodeling or fat migration, it's not affecting those layers at all. Those are going to occur beneath the surface, regardless of what you do in that dermal or epidermal layer of the skin. Now, I agree that these things are complementary to each other. So the question is, which one do you do first? And I think it sounds like Dr. Maxfield feels like the first move is to actually go to Botox, prevent the wrinkles from forming so you don't need to treat them. My suggestion would actually be, it's up to you, honestly. I think that if you have a lot of surface changes like discoloration, you feel like your skin is crepey because you've lost collagen, you wrinkle easier than others, then maybe treating that collagen layer and that surface layer is better to do early on. And so I actually think it really is up to you, but my ideal situation is to actually do these again in combination with each other, because I think these two together are definitely synergistic and they don't take away from each other. And when you use these two together, it makes it even better.
And then the last thing mentioned was LED light therapy, and this is a supporting role. Actually, Botox and lasers are both heroes in their respective category. LED mask, LED therapy, although we love it, is a supporting role. So this also, depending on the wavelength, whether it's blue light or red light or even green light and some of the other even less well-studied ones, they will live within the first layer of the skin, the epidermis, and then the second layer of the skin, the dermis, at most. Some of them can stimulate fibroblasts, some of them again help collagen organization, help with the youthful appearance just generally. But again, it supports those previous two being the heroes in Botox and laser.
Absolutely. So, and again, like you said, consistent use of the LED mask is actually what makes a big difference. We've always been big proponents of the Cure mask. You've seen us talk about it probably 4 years ago before anyone was talking about LED masks in a positive light. We've been big fans of the technology in general. So whether you get one from Omnilux or Current Body, or there's a new one from Shark Beauty, or you get the one that we love from Cure, just using that consistently is where we're going to see results. And specifically when he's talking about anti-aging, we're usually talking about red light and infrared light, and it stimulates that collagen production by stimulating those fibroblasts. And by doing that, your skin will be healthier for longer, but you do have to be consistent. It is a technology that we do believe in. So let's talk about looking at this from a 360 approach, because I do think the conversation around healthy aging is changing, and I think for the better. But you do need a comprehensive sort of 360 approach, and it does need to start with prevention from a very early age. The use of sunscreen is probably your first foray into the quote unquote anti-aging category. And then after that, we've talked about this as essentially a pyramid in some cases, but I really like that line graph, or that graph that Dr. Maxfield shows, because I think the different plateaus that you reach is where you want to introduce new things. And if you do this, I think this is how your skin can age in a very progressive way that you won't be doing too much later that's corrective.
Right. So after you've built on the foundation, so your sunscreen, then you add in your other hero ingredients, which may be your tretinoin and your vitamin A. Both can help you prolong health and reactively come behind and treat it. That's topical. Then you come in with your supporting steps like exfoliation, and then you have your supporting ingredients like niacinamide, like peptides. And then let's say you've maximized your topical regimen altogether. You can go into prescriptions, oral for specific treatments, whatever is relevant to you. And then you can go into procedures, and that's how you can kind of in a stepwise approach, build upon foundational things, get to the point where you're using procedures like laser and Botox or even filler if that's for you. But if you take this up and flip it upside down, it all collapses. You cannot and should not start with only one thing, only Botox and forego the sunscreen, only lasers and forego the sunscreen. It will all fall apart and you will not get the skin health you want, and you will also lose a lot of money in the process.
Absolutely. And so we've been actually in our New York office, we've been working hard because we see this direction towards biohacking and longevity. We see it in the wellness space. We see these personal trainers who really track people's diets and their hemoglobin A1C levels and their sleep, and they're trying to optimize multiple parts of somebody's life so that they're healthier for longer. And we don't really look at skin like that, and we probably should. Like, what are the things that you should be doing in a more regimented pattern? Because we look at skincare in a very regimented way, but we don't look at the procedures that happen in the office in a regimented way. We often do them as corrective treatments. Like, we see lines forming and then we treat with Botox. We see really crepey skin and dyspigmentation and lax skin, and then we treat with a laser. Rather than, when do you need these so that you can do less and have your skin age healthier for longer? Because it's always better to do things preventatively when you need them than to do them correctively when it's oftentimes got so advanced that it's harder to treat. And so we are working on sort of a protocol that would include both your over-the-counter sunscreens, cleansers, moisturizers, your prescription treatments like tretinoin, your in-office procedures like your Botox and neuromodulators and your lasers. And how do you put these on a schedule for someone so that they're part of a plan, so that they don't have to think as much as what they want to do, but you can actually react to data as it comes in. So let's say, for example, we scan your face. It shows that your main issue is dark spots. Like, how do we get you on the right prescription for dark spots, but also get you on the right laser plan and chemical peel plan to target dark spots, reevaluate the results in 3 months, and then make tweaks, because maybe your problem's not dark spots anymore. Now it's fine lines and wrinkles. We can tweak it again so we continue to optimize towards your goals without having to do so much corrective work in the future. Because I think if we approach it this way, we can actually really lean into what we've been saying for years, which is you don't necessarily need to get Botox every year, every 3 months when it wears off. But if your skin was healthier and your elastin production was better and your collagen production was better and you were using tretinoin, you could really get away with using Botox once a year to prevent the muscle contraction and keep your skin, elastin, collagen production better, like he said in this video, by using lasers. And so I actually think these things work together. So you have to do both less rather than both more. Does that make sense?
Yeah, it does. And so here's here's I think what the heart of it is that everyone wants one thing to fix all problems, and I think that's a very realistic desire. But in the real world, it is not the case almost ever. In any facet of life, usually you do have to have a little bit of a more holistic approach, a more systematic approach where you target each thing and everything works together for one common goal. This is no exception.
And if I could just build like the most simplified, basic year routine for somebody like us who's in their mid to late 30s, as some may say, I would do cleanser, moisturizer, sunscreen, a retinoid, whether it's tretinoin or an over-the-counter retinoid. I would do Botox once or twice a year, or any type of neuromodulator like Dysport. I would do 1 laser treatment a year, whether it's Fraxel, Multi-Frax, Clear and Brilliant, Halo, whatever you want to use. And that's really it, honestly. That's what I would do. And I think if you did that in your mid to late 30s, you would age very gracefully, and no one would ever say, oh, this person looks overdone or unnatural. You would age very naturally. You wouldn't get rid of every fine line and wrinkle, but you would look very healthy for much longer.
Yeah, it would be incredible. I mean, just thinking about that routine, you have no idea how impactful that would be. Hopefully, this kind of gives you an idea of where to start in terms of building out a complete routine for healthy skin, for longevity, for a lifetime of youthful skin to match your youthful, optimistic heart. But yeah, that's pretty much it for this one. Hopefully it was helpful for you. If there's something else you want to talk about, if you have any questions, let us know in the comments, and we will see you next time.
Please like, comment, and subscribe, and we'll see you in the next video.